Hi guys, Dr. Charles Chabert, urologist and director of the Prostate Clinic. If you're watching this video, you are either A, interested in having a Greenlight laser prostatectomy, or alternatively are scheduled in to have the procedure. To recap, a Greenlight laser prostatectomy is a type of treatment that we use for people who have bothersome urinary symptoms related to prostatic enlargement, or BPH. So in this video, I wanted to highlight some of the key considerations to make you aware of what will happen just before you have your procedure, during your hospital stay, and what you can expect in the post-operative period. So to begin with, before we get to surgery, as a matter of routine, every man has a urine test beforehand just to ensure that there is no infection in someone's waterworks before we proceed on. If there is, we treat that with antibiotics, but for the majority of people, we find that there's no infection and we can proceed on. One of the most important things before we get to surgery is to make sure that you highlight for us if you are taking any blood thinners. If you are, please let us know which blood thinner you're taking, the dose of the medication that you're taking, and then we can come up with a unique plan for you with regards whether or not you stay on this drug, or alternatively if you stop it. And if you do need to stop it, what sort of time frame do you need to stop the medication before we proceed on with your surgery? For some people, we will make arrangements for them to be assessed at the pre-admission clinic, and during this time, a discussion with one of our pre-admission doctors will be undertaken. Sometimes people have a tracing of their heart performed, and if there is anything that is discovered either through this tracing of the heart or potentially some additional blood work, then those investigations will be organized before people have their surgery. The surgery with me is performed at Pindara Private Hospital. This type of surgery we do on a Tuesday, and usually it's on a Tuesday morning that we perform the treatment. For the majority of people, they are admitted in the morning of surgery and they go through the admission process before they come round to the anesthetic bay. Well, you will meet your anesthetic doctor, have your pre-med, and then we'll proceed on with your treatment. For the majority of people, the surgery takes around 45 minutes to an hour to do. When you wake up, you will have a catheter in place, so that's a small plastic tube that's placed through the penis into the bladder, and this ensures that the bladder drains adequately immediately after the surgery. If you have a look down into the catheter bag when you wake up, you may see small amounts of debris, you may see a little bit of blood in your urine, and just remember a drop or two of blood goes a long way, but this, in the majority of people, settles down pretty quickly. One of the first things that you may notice when you come to from your anesthetic is that you may have a sensation that you feel like you need to pee. In just about everyone, this is related to the surgery itself and also having a catheter in place, and usually settles down within the first hour or two. For most people after this surgery, we leave the catheter in on average for around 14 hours. So if your surgery is first thing in the morning, we usually take the catheter out at midnight on that same day. If, however, your surgery is a little bit later in the day, we might keep your catheter in place until around 6 o'clock the following morning. I'll pop round and see you the next day, so day one post-operatively, and I usually come round between 7:30 and 8 o'clock in the morning. We'll have a little look at things and see how you are traveling. When we remove the catheter, the aim obviously is to get you peeing, and we do what's called a trial avoid, which in essence means that we get you to pee 3 times before we allow you to be discharged. Every time you pee, you do it in a jug. We check the volume that you pee, and we do a little bedside ultrasound to make sure that you're emptying your bladder okay and not retaining too much urine. As long as you fulfill our criteria and give us 3 ticks and 3 boxes, we're happy for you to head home, as long as you're happy to head home at that time. If for whatever reason you're not emptying your bladder as well as we would like, then we would keep you in hospital until your bladder does empty properly. And sometimes that can result in people staying a second night in hospital, but for the majority of people, about 90% of people, they can be discharged home on the same day. When you pee, it can sting and burn, and usually that settles down within the first day or two. It's not uncommon to see some blood in your urine that you can see intermittently over the course of the next few weeks after your surgery, but for the majority of people, it's pretty mild. If you are taking blood thinners, it is more common to see blood in your urine after the surgery, and it's more common for that blood that you can see to last a few extra weeks. Also, if your prostate is really big and it takes us a lot of work to do the treatment, we can also see that in that group of individuals that there can be blood in your urine that can last a little bit longer as well. The expectation after surgery is that within the first few days, you would have a significant improvement in the pressure with which you pee, so your flow goes up. You may remember that before we get to your surgery, we do a flow test in the office, and that really just objectifies for us the pressure that you generate. As part of your follow-up procedure, we see men at the 3-month mark and we repeat the flow test. And at that time, the expectation is that you would have a big improvement in the force with which you pee. So that's, for most men, that's the first thing that we see. So the pressure goes up, and that's really the outcome measure that I look for to determine how successful the surgery has been. There are some symptoms that are related to your bladder, and they include rushing to the toilet, going more frequently, and getting up at night to pee. And those symptoms are the slowest to improve after surgery. And it's really related to your bladder having time to adjust to the changes that we have made. So we unblock the bladder by treating the prostate, and then we allow your bladder to adjust to no longer being occluded. And during that process, what we tend to see is for the first couple of months after surgery, men may still go frequently, they may still rush, they may still get up at night to pee, but gradually those symptoms settle down with time. Okay, so that's what we expect from a functional point of view. Around about 10 days to 2 weeks after your surgery, the healing scab inside your prostate can sometimes come away. And the manifestation of that is that you may notice that you pass small pieces of debris that might look like tiny pieces of sponge round about the 2-week mark after surgery. This is very normal, it's part of the natural healing process, and you may notice a little show of blood after you pass a small amount of debris. This is really just your body's way of getting rid of that healing scab as the prostate becomes resurfaced during the healing process. So all very normal. From a sexual function perspective, you remember sexual function is 2 things. It's ejaculation and it's erections. And ejaculation changes permanently after this surgery. So just about every man following any form of cavitating surgery has a dry orgasm after that treatment. So it's important for you to be aware that yes, you can still have an orgasm after surgery, but that it is going to be dry. So there will be no fluid that's emitted, and it is a permanent change. As far as erections go, the likelihood of your erections deteriorating after surgery is incredibly low. It's less than around 1%. So it can happen, but it's incredibly rare, and my expectation for the majority of men is that their erections will remain unchanged. They certainly do not improve with this treatment. This treatment is there to allow an improvement in the way that you pee. For the first couple of weeks after surgery, the do's and don'ts, if you like, happy for you to go for gentle walks along the flat. Don't play golf, don't lift anything heavy, stay out of the surf, don't ride a bike, don't have sexual activity to begin with for the first couple of weeks. Just let everything heal. If you do too much too soon, you do run the risk of teasing away a larger proportion of the healing scab inside the prostate, and this can result in an increased show of blood at that time. So please, for the first couple of weeks after your surgery, take it generally easy, and then from about the 2-week mark, you can gradually increase what you do. As I alluded to earlier, I see every man back in the office at the 12-week mark. For the majority of people, this has given the bladder time to heal. We do a flow test. We repeat your questionnaire to see how your urinary function has improved, and we answer any questions that you may have at that time. I hope this video helps. If it has raised any questions or if you have any comments, if you are awaiting this surgery with me, or if you are awaiting this surgery with someone else and you have some questions, please feel free to leave your comments in the dialogue box below, or alternatively contact my office and my staff will answer your questions or get your question through to me. Hope this helps. If you enjoyed this video, please give us a thumbs up, and if you haven't already, please subscribe to our channel for more information about all things prostate. Thanks again.